Hey everybody, so it's that time of year again. It is open enrollment for Obamacare stuff. Open enrollment is coming right around the corner, November 1st. So the video made last year is the exact same stuff that we would talk about this year. So I'm going to save myself the trouble. I'm just doing this introduction to let you know that you're going to be watching the same video as last year. Just replace the 2020 numbers with the 2021. Instead of going to carlospolito.net, this year, we're just going to go straight to carloshealth.com. It saves us one step on choosing what type of appointment we need. So, carloshealth.com, pick a date and time that works best for you, and then we can revisit everything if we need to, okay? I will see you guys here at the end. Hey, everybody. So, it is that time of the year again. It is October 11th today, Friday, October 11th, late at about 6:30. I'm recording this video. But we are in that period again of open enrollment, right? Now's the time to figure out what we're going to do for 2020. Okay, so I'm going to make this quick. I made a longer video last year, but I just figured we do everything during our appointment anyway. So I'm just going to give you like a 30,000 foot overview of what we need to do, what I need you to do, and what to expect when we have our meeting. When you set that appointment, okay? And plus, I have to do these videos. I have to do 3 more videos, one for Medicare, and they both have to be in English and Spanish. So I'm running out of time, so we're going to knock this out really quick. So what is open enrollment all about? Well, open enrollment is specifically for the Affordable Care Act, Obamacare, okay? The government gives us a specific time window to get one of these Obamacare plans, Affordable Care Act plans, if we need to get one of those plans, okay? The period is from November 1st through December 15th. The reason why the government gave us that time period is because these Affordable Care Act plans, Obamacare plans, they cover all pre-existing conditions, right? So if you were diagnosed with cancer yesterday, then good thing is that if we're eligible to enroll in an Obamacare plan, we can get it and it'll save our life, right? So they don't just want you signing up for an Obamacare plan when you get sick or when you feel like it, right? They want you to have the plan in place so that if you do get sick, then you're covered, not just to get insurance when you finally get sick, right? It's not like crashing your car without insurance and then calling the insurance company the next day like, hey, can I get insurance for the day prior because I had an accident, right? It's just not going to happen, okay? So why would anybody want to go Obamacare? One, for that reason. Number one, it covers all pre-existing conditions, okay? So whatever you got going on, we're going to have benefit for it, okay? Number two, it goes along with the pre-existing conditions is that it's guaranteed issued. Nobody's going to ask us some medical questions. Nobody cares about our medications. If we're eligible to get it, which everybody is eligible to get it during open enrollment, we can sign up and grab it, okay? The other good thing about it is that it covers maternity and mental health. If one of you guys is planning on getting pregnant, is already pregnant, then we almost have no choice. We have to go to an Obamacare plan, okay? If you need to see your mental health specialist, we have no choice. We got to go Obamacare, okay? The Obamacare plans also give us, they're required to give us prescription drug benefits, okay? And all Obamacare plans, Affordable Care Act plans, cover our preventative services once a year. So that annual checkup, that physical, that if you were at that age where you're required now to get a mammogram or colorectal screening, colonoscopy, things like that, then all that stuff that's coded preventative will be covered 100% by the Affordable Care Act plan. Okay, so just to be clear, Obamacare, Affordable Care Act, they both mean the same thing. It's just it's the by Donna, it's the law that says that if you want to get health insurance because you have a pre-existing condition, then you can do that. You can sign up for a plan that covers pre-existing conditions. Okay. Okay, so now, what's not so good? What's also good about it? Wait, one more thing. If we're eligible to get financial aid, then we can do it during this time period. Okay, if your income is at a certain level, we can do the application, tell them about our income, and then And then depending on that, we'll get a ton of money to help us pay for the plan, right? So you have to be making a certain amount of money to get the financial aid, okay? If we make over that amount, then, man, maybe I should turn off my phone, huh? Hold on one second. Just thinking about this. Okay, I'm turning off my phone. I'm going to turn off my email. Yeah, this is probably a good idea, right? Okay, sorry about that. So, if we're on limited income and we need to get financial aid, this is one of the reasons why Obamacare was written into law, so that we can get help paying for our health insurance. Okay, so if your income falls within a certain level, we might get a bunch of money to help us pay for that plan, and we're not going to leave that money on the table, especially if it's a lot of money. It's ours. It's part of the law. If we don't use it, we lose it, as they say. Okay, if you make too much, then they're just going to say, hey, you don't qualify for any kind of subsidy. You can purchase health insurance. You just got to purchase it full price, right? If we fall below a certain amount, then they're going to say, listen, the federal government's not going to give you subsidy. You should try go getting help from the state, which is Medicaid. So they're going to tell you to go apply for Medicaid. Okay, so good and bad things about that, about your income. If it's at a certain level, then we can get a lot of financial aid. If it's more, I'm sorry. If it's less, then we're going to have to try Medicaid. Okay. So this is all the good stuff about Obamacare. What's the bad stuff? Well, again, we're only allowed to get it during this time period. So now's the time to think about if we want to get a plan that covers the pre-existing conditions and gives us these benefits, right? And if we want to get a plan where they might give us a lot of financial aid to help us pay for the plan, again, we don't want to leave that money on the table. What's bad about it is that if we miss this time period, then they're going to shut the door on us hard. They're going to lock it, and we're not going to be able to get in until the end of next year again, right? The only time we can get Obamacare plans outside of this open enrollment period is if you experience some sort of qualifying life event. For example, I lost health insurance through a different source. An example would be I had a job, I got fired, or I quit, or I retired. I had Medicaid. I lost Medicaid because my income was too high. I turned 26 years old. I got kicked off of my parents' plan. I lost insurance through a divorce. All those things would be qualifying life events, which would allow us to jump on an Obamacare plan. But again, they only give us 60 days from the day we last have coverage to jump on the Obamacare plan. And if we don't, they shut the door and they lock it hard. Right? And we won't be able to open it until next open enrollment. Okay, that's bad thing number one. Bad thing number two is the PPO plans of old, as a lot of you have experienced, they pretty much no longer exist, right? The PPO plans of old, where you purchased one of those and you can use it all over the country, those no longer exist. Let me see how I can shut this off. Oh my God, I just purchased this Mac, and let me shut these off too. I'm getting used to a Mac, so I apologize. Okay, now I got that off. So PPO plans of old, you had a PPO plan, you can use it all over the country. That's no longer the case, right? Most Affordable Care Act plans are localized networks in your county, at best between state lines. And the reason for it is because, again, since the inception of Obamacare, the networks of doctors and hospitals have shrunk. And it's because two reasons. You know, the carriers, they're trying to save some money, so they're going to kick out all the teaching hospitals that charge them a lot of money. And the doctors also feel like they're not getting paid enough, so they're going to jump ship and say, listen, I'm not taking your plan. I don't have to be in your network, right? I got enough clients on my own that want to pay me cash, or other networks that pay me a lot better than you do, right? So those are the two reasons why the networks have shrunk, okay? Last bad thing about Obamacare is that it can get pretty expensive. You know, for a family of 3, 4, or 5, they can rival mortgage payments, right? And sometimes we just can't afford that mess, right? So we try to figure out if we qualify for any kind of subsidy that'll help us pay for that plan. Great, we'll take that opportunity, okay? So that's the general overview of what Obamacare is all about and why we should think about taking advantage of this right now. Okay. What are the alternatives? There's a bunch of alternatives. When somebody's shopping for health insurance, there's usually five ways you can go about it. ACA Obamacare plans, short-term medical plans, fixed benefit plans, minimum essential coverage, and these Christian, co-op plans, the faith-based co-op plans, right? I really only focus on these three because the other one, I do the minimum essential coverage too. Only when we're bundling it. Well, I do these three. I do the short term, I do the fixed benefit, and I do the minimum essential coverage for sure. Okay. A general overview of the short term plans. Short term plans work like regular health insurance. If you get sick, you get hurt, whatever, we have health insurance, right? There's just limitations to it. The limitations are that they're not going to cover pre-existing conditions. That's number one. They're not going to cover maternity and mental health, okay? And they're not going to cover joints in the sense that you're 60 years old and you've had bad knees. Now you get this plan and you want to get knee surgery. That's not going to happen. If you fall down and break your knee, then that's different. You have insurance for those facts. But for pre-existing conditions, no, they're not going to help us, okay? The other thing is, the other thing is that it ends abruptly. It will end after a certain period of time. Okay, in the state of Illinois, decided that we can only get these plans 6 months at a time. So after 6 months, if something happened to us, if something happened to us within the first 6 months, we have to reapply again for a short-term medical plan with a different company, and then they won't cover any pre-existing conditions. So if something happened to us in the first 6 months, the next 6 months is not going to be covered, right? So there's some pros and cons to short-term medical. What's the good thing about it? The good thing about short-term medical is that you can use it all over the country, right? Most of these plans are PPO plans with large networks of doctors and hospitals. So if you wanted to go to California, Florida, Texas, and use your short-term plan, there's going to be doctors that accept a plan, okay? The next thing is that they're usually less than half the cost, right? So somebody doesn't want to pay for everybody else's stuff, pre-existing conditions, they're healthy, they don't need maternity, they don't need mental health, they don't take medications, then a short-term major medical plan is perfectly okay, right? We just have to understand the risks that no pre-existing conditions, it's going to end abruptly, and we have to renew the policy every time it ends, right? So this is just Illinois. In other states like Florida, we can get the short-term plans for 12 months, and we can purchase 3 12-month plans all in one sitting in some states like Georgia, right? So when the time comes, we'll talk about the short-term plan, and we'll figure out if that's right for you. A fixed benefit plan is great because no one's going to take that away from us. That stuff is permanent, right? Problem is that it works in reverse, a little bit in reverse, like upside down of a regular health insurance policy, where a regular health insurance policy, we have to pay first as the patient, as the member of the plan. We have to meet our deductibles and out-of-pockets and whatnot, and then the insurance company covers the cost, right? And then the insurance company participates. On a fixed benefit plan, the roles are reversed. They pay first. They pay their amount no matter what, and then we're responsible for the rest, right? So what we like to do is we like to combo a good, strong fixed benefit plan that's going to pay first dollar, that no one's going to take away from us. No one's going to take that away from us, even if we get sick, okay? And we couple it with an affordable short-term plan to limit our financial exposure. That one has deductibles and out-of-pockets, our limits as to what we can lose, and then the insurance company covers the rest of the cost, right? So we package, again, a good, strong fixed benefit plan with a affordable short-term plan. I believe that is always the best way to go when we're talking about alternatives to Obamacare, okay? There's also things called minimum essential coverage that a lot of you have with me. Minimum essential coverage handle all the day-to-day stuff that people are looking for. Some people don't really care about hospitalizations and things like that. They just want the day-to-day stuff that everybody's looking for. They want to be able to go get their preventative services. They want to be able to go see a doctor a couple times a year with a copayment. They want to be able to get a few medications at low cost. And the best thing is they want to be in the 21st century, and they want to talk to a physician over the phone when they want, wherever they're at, right? So a lot of these minimum essential coverage plans have telemedicine services, and so do these short-term plans and fixed benefit plans. So we'll talk about telemedicine services also if we're looking to get into some of these alternatives, okay? And then obviously we're going to talk about the gap insurance things like accident and sickness hospitalizations, right? A lot of you guys have these plans. The number 1, 2, and 3 reasons why anybody would ever meet their financial exposures on any of these plans is if you have an accident, a cancer, heart attack, and stroke, or some sort of sickness hospitalization. And we're going to offer you a supplement that will cover your financial exposure over here in the event of one of those 3, right? So the game plan is to get something that's affordable and then package it with a supplement. That way, if the worst thing happens to us, one of those big 3s, then we're covered by the supplement. And the insurance company the supplement will cover all of our deductibles and our financial exposures. And then once that's covered, the Obamacare plan is going to take care of the rest, or our short-term plan is going to take care of the rest. Okay? Though that always comes out to be a better price than going with a lower deductible Obamacare plan or a lower deductible short-term plan. We're going to be spending way more money for something that we may not ever use. We're going to give that money to the insurance company, and they're never ever going to give it back to us, right? So why don't we hold that money in our pocket? Why don't we use some of that money to purchase a supplemental plan like a cancer, heart attack, and stroke, and a sickness hospitalization plan, and then save the rest in our pocket, right? And then we're also going to talk about dental and vision policies. And for those of you guys who have families who want to talk about life insurance policies, we can do quick, $100,000 life insurance policies or $50,000 life insurance policies or whatever, up to $2 million life insurance policies, whatever you guys are looking for, we can definitely work that out for you. Okay. So guys, I want you to do me a favor. I want you guys to go to, click on the link somewhere here. It's carlospolito.net. And it's going to take you to my Calendly. Give me 1 second. Let me see if I can open up this thing without showing you everything I had. Okay, hold on 1 second. It's a new Mac. Forgive me. Do we force quit? Okay, we're going to force quit. We're going to pull Chrome back up. All right, perfect. Okay, so carlospolito.net. Somebody has .com. I've contacted them. They haven't responded back to me. I think one day I'm gonna get it, but for now it's just carlospolito.net, and pick the right one for you. If you're watching this video right now, we're talking about open enrollment for under 65, Obamacare, and the alternatives. Then you're gonna click on this health insurance consultation. You're gonna pick one of these dates. You're gonna pick a date and time. You're gonna get 2 email reminders, one a week before, one the day before, and then you're gonna get some text message reminders. Again, a week before, a day before, an hour before, just to remind you that we have an appointment. Okay. If for some reason you need to reschedule, it's perfectly okay. I know things happen. Life is crazy and fast, and sometimes we don't have control of the stuff. It's okay. Just let me know. Let me take you off my calendar so I can fill it up with somebody else who's ready to go. Okay. But what else do we need to talk about? Let me think. Again, I'm just doing this rather quickly, but for those of you I haven't gotten to, I've got a bunch of voicemails on my phone that I haven't gotten to. I'm going to give you a call and put you on my calendar. That way I have a set appointment to talk to you, and I'm not disturbed by anything else, and we'll get it done. Okay. If we talk and we have to reschedule for another day because we can't come to a conclusion, then that's okay. Well, if we have an open spot somewhere, we'll put you for another day. Okay. But what I want you to do is obviously watch this video. If you have questions about some of the stuff that I spoke about, write them down, and and let's chat. Let's figure it out. Have all your information ready. Let's talk about if there's any change in your income, any change in your living situation, if you moved, have all that stuff ready so we can update your healthcare.gov account, or if you're new to me, have all that ready so we can talk through this and everything can go smoothly. Okay, so what we'll need is everybody's infos, everybody's socials, all the income that's coming into the household, any income that's from different sources like Social Security, disability, things like that, any kind of rental property income, all that stuff we need to put down on an application if we're going to go the Affordable Care Act route. Okay, guys, I hope everybody's doing well. It's going to be a circus for the next couple of months, so bear with me. If I don't answer, leave me a message or just go to carlospolito.net and book yourself an appointment, and it's all for you. Nobody else will disturb us, and I'll give you an hour, and we'll figure it out together. Okay, guys? Great. I will talk to you guys soon. Bye-bye. Okay, great. You guys made it all the way to the end. I appreciate that. I appreciate your patience. It is the same video from last year, but it's the exact same stuff that we're going to be going through in 2021. Okay? So, favor, carloshealth.com. Pick a date and time that works best for you, and we have a whole hour to ourselves, and we'll knock it all out. If anything needs to happen beforehand, please shoot me a text or shoot me an email, and I'll try to get back to you as soon as I can. It is circus time. It is people. The government only gives us 45 days to help all of our clients out, and that's almost impossible to help out everybody. So if you do get a chance, carloshealth.com, and pick a date and time, and we'll knock it out. We'll knock it out then, and we'll continue on as normal, and we'll see each other again next year to do the same thing. Okay. I look forward to seeing some of you guys and talking to some of you guys. Take care, and talk to you later. Bye bye.